I'll make some quick introductions. Dr. Waquas Khan is here. He's an internal medicine hospitalist. He's the creator of the healthcare. I was handed this card, so the writing is a little small, so I apologize. Creator of Healthcare Web Fair series, a satirical, comical, educational series about sensitive issues in healthcare, and I've heard lots about them, and I know I absolutely have to see them, and we'll have the opportunity to meet him first. Dr. Venu Julapalli, who's been here at the conference, who's a gastroenterologist, and student Dr. Parth Desai, who spoke earlier. Thank you for coming up, and we'll give you the floor.
Please have a seat.
Thank you. Thank you.
Thank you very much for inviting us over here. It's been an honor. My name is Waquas Khan, and I'm an internal medicine doctor practicing as a hospitalist. I'm also the creator of the web series. It's called Healthcare Not Fair, and it's basically a satirical, comical, and at the same time educational web series about the sensitive issues prevailing in healthcare. It has received so far both mainly appreciation, but lately a lot of criticism and controversy as well, because once you deal with issues like individual responsibility and choosing lifestyle choices, which I think should be the main objective of our healthcare, then you can end up facing the criticism. But what I see about healthcare right now as a young physician is like an impending healthcare apocalypse. We are just heading towards something that we may not be able to control anymore on our own. And this is the time that we discuss openly all these issues. And it really brings down to a teamwork between physician and patient. So far in my experience, I have been feeling that there's a huge barrier between a physician and a patient to discuss the sensitive issues about good healthcare choices and living a risk-free lifestyle. And a lot of time these issues come from the culture that we have developed, that counseling a patient and then making them realize that just holding an insurance card in your pocket does not justify enough that you're fulfilling the requirement of individual responsibility. But actually the individual responsibility comes down to choosing a healthy lifestyle. Now, from physicians' perspective and also all the other major players in there, how do we treat or take life? Is that a commodity or is that a responsibility? Because if is that a commodity, then we are really putting a very low price to that. Because if I ask any one of you, how much price tag do you want to put on your life? A lot of you may not be able to come up with an answer. So, because to price somebody's life is very difficult. The whole point is, it's a responsibility. And once it's a responsibility, whose responsibility is that? And I would like to quote Dr. Marcy, is basically boils down to who owns your life. You're the person as a patient who owns your life. And as a physician, I'm here to help you and facilitate you to make sure that this journey of living a healthy lifestyle is like a breeze for you, and it's not like a sandstorm because of all these other restrictions that come from the insurance companies, the pharmaceutical companies, sometimes medical malpractice laws, and obviously the government restrictions. So in the end, I would just like to summarize my 2 cents on that. It's basically a teamwork between a patient and a physician. And there should be nobody else involved in this sacred relationship. And I think if we are able to establish this this main platform of teamwork, then we can achieve so much that we haven't been able to achieve for the past many years.
I completely agree with what you're saying. I've said to others that all the changes that we've had in the past few years, they're just moving deck chairs on the Titanic. I mean, it was all about access to healthcare. And we have more access to healthcare now than we did before. But I've often said that if you really want to bend that healthcare cost curve down, this is not going to do it. My belief is the only way that you bend the healthcare cost curve down is to do what you just said, is to encourage healthier behaviors and to shift responsibility and share it among yourself and the patient. And I think we're uniquely positioned to be able to do that. Myself personally, I've been in practice for about 10 years. I'm a gastroenterologist. And I think that I am as well positioned as anybody else in the world of healthcare to serve as the health coach for the patients that I see. I think we're in the prime position for that. And that actually leads me to my question for you. As a hospitalist, I work with a lot of hospitalists, and one of the things that I see in terms of just the atmosphere of hospitalists is because they're in this kind of shift work model, there's a certain removal of the accountability. And my question to you is, how do you see your role as a hospitalist in these issues of helping patients with lifestyle and individual responsibility?
Well, that's a very good question, and I think the way I would really answer that, I feel a lot of restrictions. The way we have established this culture that you just do your job, what you're supposed to do, and you just get out, it's not working anymore. And the way you can really make sure that a patient is not getting readmitted into the hospital is by counseling and spending more time with the patient. And I'll be honest that being a hospitalist, I have been rounding sometimes between 20 to 25 patients. And at night, if I'm working as a nocturnist, I'm admitting sometimes 10 to 12 patients while covering around 70 or sometimes 100 patients on the floor as a cross coverage. This is like a tremendous amount of work, and you're basically working as a robot, as a machine. You're not working as a human being, and you're not having any time to get emotionally involved with the patient, and vice versa. The patient is just sometimes there, either could be because of a natural problem, and sometimes I may use a little harsher, like maybe self-inflicted problem. But the thing is, to counter both sort of problems is to have enough time to counsel the patient. If we are able to spend time with the patient, then I think we can really make a huge difference. So far, the biggest problem I've been facing, especially as a hospitalist, is the workload is tremendous. It's like basically horrendous, and we are just basically working as a machine, and we are just counting the numbers, and we are not really counting the human beings.
Absolutely, absolutely. I think the core of what we really need to change is a bigger push on preventative medicine. I think there's a lot of talk about what preventative is and what preventative medicine is and isn't, but the bottom line is we can help heal a patient after they're already sick. We can heal them and turf them out the door. But how can we keep the patient from coming into the hospital to begin with? And that's where now with after Obamacare, when our patient base increases by 20-30%, we're going to have more of a push on that. We don't have the resources anymore to keep doing cardiac bypasses and stents on patients that could have been prevented from coming in there in the first place. And that's one of those things that I think now it is something that's growing. But even in my experiences in medical school, and in medical school, there isn't enough of a push on it even. People don't talk about it as a real profession. Like, you want to go into GI, you want to go into internal medicine, you don't want to go into preventative medicine. Is that even a specialty? But in reality, it should be. And it should be something that every doctor integrates into their practice. How can we prevent this patient from needing to be treated? Because that's the bottom line. Any thoughts on that?
Yeah, and, I think one reason you feel perhaps like a cog in the machine is because that's how you're treated. At least from the outside looking in at the hospitalists that I've come across, they are part of this big conglomerate now. They're in many cases employees of the hospital system, and they have been relegated to become commodities in service of this system. And so, when you're treated like that day in and day out, I can understand how it becomes somewhat demeaning.
So I totally agree with you that the preventive medicine seems to be the key. And we are spending much more money on actually tremendous amount of money on the consequences that are coming from not practicing the preventive medicine. So now how to practice or really advocate or promote the preventive medicine? We really have to bring down these barriers between the patient and the physician. Right now it seems like the physicians are sitting in one corner of the room and the patients are sitting a mile away in the other corner. And there's a huge distance of being scared that the patient may get offended if you are just going to take an extra step to tell him that these are the measures that you need to take that will prevent you from coming back to the hospital. And this Affordable Care Act, I really honestly believe that has really promoted this kind of culture that now if patients, they think that they have insurance, they have access to the ER, and that's why they are really overburdened, and then they can really come in and out of the hospital as they please. And on the other hand, the hospitals and the physicians are getting penalized for the readmissions, and all the burden has been placed on the shoulders of the physicians. And the hospital administration is also, along with insurance companies, is really penalizing the physicians that you are not doing a better job to keep that patient away from the hospital. And it's really, maybe I'm not really grasping it, but how can a physician keep a patient away from the hospital if that person is not really complying with the instructions? The most common presentations are CHF, COPD, non-compliance with diabetes and the medications. So even after being given all the instructions, if someone is not giving a very serious thought to quitting smoking or fluid restriction, taking the medication in time, I don't understand that how can a physician play any further role to keep that person away from the hospital. And for that, we really need to tear down those barriers when the physicians can feel very comfortable discussing these issues with the patient and tell them, I am playing my part, you need to play your part, and we need to work as a team. And if you guys are fans of wrestling and there's a tag team match going on, if there's the tag team partner is not jumping in to help you out, then the opponents, which are, I would say, like the hospital administration and insurance companies, they can beat the hell out of you. And that's what's really happening with us. The physicians are really getting beaten up by these administrations and the insurance companies. But on the other hand, our tag team partner, which are the patients, they are just not just coming in to rescue us.
Yeah, it's not an easy issue. Parth, I had a question for you.
Sure.
Because you have your unique perspective as a med student. So I volunteer once a month, where I trained, and I see residents, I see some medical students, and correct me if I'm wrong on this, but I get the sense in being around them that they're content, in general, they're content with coming out and becoming physician employees, because they want that security that they're not, that they're uncertain that they won't get unless they become part of this system. Is that the ethos you see where you're at?
I think you're definitely right, and I think there's a majority of students in medical schools throughout the country who just want to do it for that comfortable position, just get out there and just be comfortable. But it's tough to generalize when it's such a large population, because you definitely do see medical students that still want to change the field for the better and do things that are improving, and not just sort of sit in that level of contentment where they just sort of go with the flow of everything. And but I agree with you. I think there should be more of a push from my generation of how we can improve medicine, because what's sort of happened in the past maybe 15, 20 years, we've seen that this sort of passive, almost passivity to watching all these new regulations and new things change medicine get us to where we are now. And it's not at all the fault of the practicing physicians now, because it really is, and you guys know better than I do how hard it is to be a practicing physician, have a family life, have a social life, to be a real person. And so when do you have time in the day to really fight these regulations that are wrong? So it's something that I can understand why it's happened, but I think that if we can get the younger generations, my generation, to sort of get these problems, find solutions to these problems before they become problems, that's really going to be the future of medicine.
The thing I'm admiring about you is, and this is one of my themes, is I want more entrepreneurship in medicine, like real entrepreneurs. My little brother is an entrepreneur running a startup in Silicon Valley. I did not know his world, because that is not the world that, frankly, we live in the day-to-day practice of medicine. But it's a really cool world. And that philosophy of entrepreneurship, where you're putting skin in the game of your own, but there's big rewards if you serve something that is a problem out there, and that's what you're doing. And it takes some imagination to do that. I mean, you're using your medical understanding and growing up with your family and now in medical school, and you're branching out now to something that is related to medicine, but it's not the standard of medicine that maybe your father and my father were going through. So how did you get there, and how many of you are there?
As far as how many of us are there, that I don't know, but I do know how I got here. And it's sort of, once you sit back and just see so many problems that exist, and in your mind, everyone can sit down and say, okay, here's a solution that I would have to this problem that I see. But if you're willing to take the next step, and I think this is something I got from my parents, that not just to let things be as they are. If I have any if I have any ounce of breath left, I'm going to do my best to make a change and do something that can better society. And that I think is what the push should be in medical school. Right now, there's too much of a push. Like, medical students are overworked. We get no sleep and spend all our time studying. So when is it for the regular medical students? And medical students are the future of this country. They should be making the big companies and the big changes that help progress our society. But right now, they don't have time. And the same with doctors. Doctors are overworked. They spend the time they're not with their patients and they're not doing paperwork, they have to salvage with their families and do things that are really important. So if there could be a way to get rid of some of this excess, pointless time that doctors are having to spend, I think that doctors would be able to do this. And doctors are the most important people that can be entrepreneurs and make changes, because we know things we have different perspectives. Because an entrepreneur, someone on the IT side, even if they're a biomedical engineer, they don't know patient care and clinical medicine like we do, and that we're trained to do. They don't know the solutions that only we can see the answers to. And if we're forced to spend all our time doing pointless paperwork and do things like that are almost a waste of time, then that's really just taking away time that we could be solving the bigger problems and the bigger issues.
I truly believe that what you're doing and the initiative you have taken is like really commendable, and it is your generation, or if I'm not considering myself too old, so it's our generation that can really make the difference. And we really need to step forward, and that thing has to start from the medical school. You just cannot wait to graduate from the medical school, go through this gruesome internship, and then later on realize that oh my God, I didn't sign up for this thing, and what I've gotten myself into. So if you are already kind of training yourself and knowing what you really want to get out of this field from at an early stage, then you may not end up being as discontent as a lot of physicians they become in the early part of their practical life as a physician.
Yeah, I mean, again, because of my connection to Silicon Valley and that world now through my brother, I see us as physicians having a grand opportunity to actually influence with our knowledge and our level of expertise what these guys are actually doing in Silicon Valley. Because you're exactly right. I mean, there are some brilliant minds there. They don't quite understand what we do. And they need us to actually tell them what our specific problems are. And frankly, you know, many of them, they don't appreciate the aesthetics of medicine. They get all the technological parts of it, but if you don't incorporate the aesthetics of medicine into that technology, I mean, what do you actually have? I mean, why is Apple so revered? Because Steve Jobs realized that there's an aesthetics to technology. And so that's what he built, and that's what everybody loves. So that branding that he has now is what has millions of people with iPhones. And so that's what I would want to see, this marriage of Silicon Valley or technology and what we do as everyday physicians. I think there's a grand opportunity there.
Absolutely. I couldn't agree with you more. Absolutely. These days, one of the big problems you see, especially in healthcare IT, is there's a big disconnect between the IT world and the physician's world. They're doing their best to try to make solutions to our problems, and they're obviously physician consultants and people that are helping them, but they're not really getting it right. We're getting solutions that are from an IT perspective, not a physician's perspective. And once we can solve that disconnect and make it flow together, we're going to have the right solutions and the solutions to the big problems.
So I truly believe like that's where when the campaigning comes, like we as physicians can hold a lot of seminars like this, and it's a great effort, and we should be having much more like this so that we can brainstorm the ideas. But the way we can really reach the mass audience and we can really tell the general public what's really happening with us and what we feel and what we really think, other than the TV doctors that they think like represent a true physician in the real life. We need to make sure that we campaign for our own self. And right now we are pretty much blessed with this, having this social media that has made things so easy for us that you just put something on YouTube or on Facebook, on Twitter, and that goes viral within a matter of seconds, depending on how much attractive that post is. So, and that's what really led me to make this satirical and comical and educational web series, Healthcare Not Fair. That's the name. I mean, you can search it as www.healthcarenotfair.com, and it's the same page on the Facebook. And I have so far launched 3 episodes on that. The first episode actually deals with the gruesome life of a routine primary care physician who's seeing like 30 patients a day, and then he ends up seeing a patient who's a hypochondriac and has a lot of complaints. Now you cannot really blame that patient for having these complaints. I mean, that's why she's here, to see the physician. But at the same time, if you go through the episode, you realize like the physician is getting constantly interrupted. He is under tremendous pressure to see as many patients as possible while dealing with a patient who requires more time. And then the same time, in the second episode, I've tried to summarize how the malpractice lawsuits, which is one of the only issues that has not been addressed or touched at all in the Affordable Care Act, that needs to be addressed, because there is no evidence that malpractice lawsuits have any positive outcome on the healthcare. So, and it has touched it on a very light note, in a satirical manner, to make patients understand that why would the healthcare costs be sometimes so high when they end up coming to the ER and having thousands of dollars of workup, and then going home with a $20,000 bill for a simple heartburn. And then third episode deals with the sensitive issue like obesity, and we are dealing with epidemic of obesity, and it really boils down to the personal and individual responsibility and your lifestyle choices. But a lot of people, they don't agree. And the reason they don't agree because we haven't really been able to sit down with them in our clinics to talk to them face to face in detail what needs to be done, because there's a huge barrier of them getting offended. And then same way I'm trying to address the issues of smoking, drug addiction, compliance with the medications, and all that stuff. These are the things which I have not been able to address or counsel in the clinical setup or as a hospital setup, because it seems like the culture that we are living now does not just promote or allow us anymore. So, and then in this way, I just tried to, you can say, vent out or show it on a different platform, like what happens and what needs to be done. And this is through the social media campaigning.
Yeah, and that's the power of kind of like Lisa's talking about, reimagining what we can do. I mean, I've gotten to be good friends with Zubin Damania, who does something similar.
Exactly.
He took his frustrations as a hospitalist and created an alter ego called ZDoggMD.
Exactly.
And put out a series of YouTube videos just making fun and using humor, which is so powerful in terms of relating our story and the frustrations of our experiences. And that transformed into him creating a health clinic that's on a subscription-based model that's being funded by Tony Hsieh. So it's like one thing led to another, and here he is, living out a reimagination of what he's doing. And I want to underscore what you said a moment earlier, that it's really about telling our story.
Exactly.
The storytelling of medicine is something that we got to really get after. We need to rebrand what we do. And I think our brand is off right now.
And we need to be more and more proactive in telling our stories. We need to be, I'm forgetting the name of the physician, the surgeon, and he clearly mentioned that we need to be more proactive on Facebook, Twitter, YouTube, and really express ourselves and tell our stories so that people would know how we feel as a person. And we need to tell them, we physicians are not angels. We are human beings with true human feelings. We can get frustrated. We are not perfect. We are full of flaws. And as a teamwork, we can really fix each other's flaws and have the best outcomes that we can imagine.
Yeah, I mean, I think bad storytelling has led to bad policy, and I think good storytelling would lead to good policy. And we are vulnerable, just like you said, we're human beings.
And by the way, my alter ego on the social media is called Dr. I Am Sorry. So, so it's a doctor who's already apologetic to either whatever the flaws he has in himself, or the restraints and or the limitation he has to provide the care which is being expected by a patient. So he's already being apologetic towards the whole healthcare system, that I'm just really sorry if I'm not able to help you, but there's not much I can do.
Parth, do you have any final thoughts about?
I completely agree with what you're saying about doctors need to get their story out more, because there's too many people out there that don't understand how difficult it is to be a doctor, and how and what you guys and eventually me one day would have to go through. Just like the doctor burnout rate is so high. There's so many doctors that are just tired. I mean, that's the best word to put it. They're tired. They've worked too hard for people that don't care, and about the people that don't care about themselves, or that don't appreciate the care that they're giving and the amount of work that goes into being a doctor. And I think if people saw that more, they would start being more sympathetic with us, because we have to live our whole lives being sympathetic to other people and trying to relate to other people. But maybe one day, if they can look through our shoes and look through our eyes, maybe we'll see a better world.
And I would mention ZDoggMD again. I mean, he's a physician from Las Vegas right now, and if you guys can watch him on Facebook, Twitter, and social media, you can really see the great work he's doing.
Thanks, doctors, for presenting a lot of important issues in discussion style and helping us laugh a little bit on the way to our solution. Thank you.